Dr. Ryan Lepore here to talk about something relatively new in dentistry that I am so excited about. That topic is salivary diagnostics, and Lepore Comprehensive Dentistry is so proud to offer it. Think of salivary diagnostics or salivary testing like getting routine blood work with your primary care physician, where your blood work might tell you your cholesterol levels or your blood cell counts. Salivary testing instead takes a sample of your saliva to tell us vital information about your oral health, but more importantly, about your overall health. We know with certainty nowadays that the bacteria in the mouth that causes your gums to bleed and eventually gum disease have a direct downstream causal relationship to heart attack and stroke. As recently as January 2019, we discovered a bacterial strain that we thought was only linked to gum disease now has an extraordinary strong link to Alzheimer's disease. Before, we did not have a way to measure how prevalent and in what ratios these harmful bacteria were present in a patient's mouth, but now with salivary diagnostics we do. By taking a simple saline solution and swishing for only 30 seconds, we can look for 11 bacteria most linked with systemic illness and disease, conditions like heart attack, stroke, dementia, diabetes, early term birth, and even certain cancers. And it doesn't stop there. There are patients out there who feel so defeated because it seems like every time they come to the dentist, they discover a cavity. Another test we perform can see if you truly are at higher risk by the bacteria in your mouth. Do genes play a role? They certainly do, and we have salivary tests that can help. Salivary tests can show whether you have certain genes that put you at a higher risk for developing gum disease and many of the other chronic inflammatory illnesses we discussed earlier, not just dental conditions. We use this information to accomplish certain things. First, it allows us to have a highly personalized treatment approach with better risk assessment for more predictable outcomes. Back to the cholesterol example, your doctor may order blood work to see if your levels are improving. This allows us the opportunity to do the same thing, establishing a systematic way to track your improvement and your progress. Finally, these tests are not just for people with pre-existing conditions or for people who already know they have gum issues or a history of cardiovascular disease. Preventative medicine is catching on in a big way. With this tool, we have an opportunity to discover potential issues down the road and help prevent them from ever happening. It has us very excited.